As your due date gets closer, there's this one giant question that just kind of hangs in the air, right? It's this wild mix of excitement and nerves and just not knowing. Well, today we are going to get right into that and clear things up.
Is this it? Is this really it? You feel a little something, a cramp, a tightening, and boom, the guessing game is on. Trust me, if you've been there, you are in very, very good company. It is the #1 question on pretty much every pregnant person's mind. So, okay, let's dive into this and get some answers.
So here's what we're going to cover. We'll figure out how to tell the real deal from a false alarm. We'll talk about those classic practice contractions, the true signs of labor, and this super simple thing called the 5-1-1 rule. Then we'll get into how to stay comfy at home during early labor. And really importantly, when you need to call someone right away. By the end of this, you're going to feel so much more confident.
So how do you really know? The honest truth is that everyone's body is a little different. Knowing for sure is often more of a gut feeling than some exact science. But don't worry, your body definitely sends out some pretty clear signals.
That's our whole goal here today, to take that really stressful guessing game and turn it into real, confident knowledge. So when we're done, you'll be way better at listening to your body and actually understanding what it's trying to tell you.
All right, let's talk about the #1 cause of those "is this it" false alarms. Braxton Hicks contractions. Pretty much everyone gets them, and they are, without a doubt, the biggest source of confusion. So understanding what these are is the first step to knowing when it's not quite time to grab that hospital bag.
The easiest way to think about Braxton Hicks, it's like your uterus is having a dress rehearsal. It's doing warm-ups, getting ready for the big day. They feel like this random tightening in your belly, but they're not actually doing the work of opening your cervix. They're just practicing.
So here's the absolute key difference. It's all about a pattern. Braxton Hicks, they're totally unpredictable. They'll come and go, there's no rhythm, and a lot of the time they just stop if you drink some water or switch positions. True labor, on the other hand, is all about that clear, building pattern. The contractions get longer, they get stronger, and they get closer together over time. And the biggest thing? They don't stop.
Okay, so if Braxton Hicks are the false alarm, what are the signals for the real deal? Let's get into the 3 main signs that should make you go, okay, yep, this is probably happening.
Here they are, the big 3. First, those progressive contractions we were just talking about, the ones with that undeniable pattern. Second, your water breaking. And third, something called the bloody show. Now, any one of these is a huge sign, but when they start to happen together, yeah, it's very, very likely go time.
Let's just talk about the bloody show for a second, because I know that name sounds kind of dramatic. Basically, during your whole pregnancy, there's a plug of mucus sealing your cervix. As your body gets ready for labor and the cervix starts to open up, that plug comes loose. Seeing this pinkish or blood-tinged discharge is actually a fantastic sign that things are starting to happen, but just know it can sometimes happen days before labor really kicks into gear.
It is also super easy to confuse your water breaking with just normal discharge. Here's the key. Think about the consistency. The fluid when your water breaks is thin, clear, and watery. It might be a big gush or just a steady little trickle that you can't control, and it'll definitely soak a pad. Normal discharge is usually thicker, more like mucus. And hey, if you're ever not sure, just call your provider. Better to ask.
Okay, so you're pretty sure you're having real progressive contractions. Now what do you do? Well, you need a practical tool to help you decide when it's time to actually go to the hospital. And that's where the 5-1-1 rule comes in. Think of it as your easy-to-remember guide for what to do next. Let's break it down really simply. You want to time your contractions from the beginning of one to the beginning of the next one. When they are consistently coming every 5 minutes, and each one is lasting for a full minute, and this has been happening for at least an hour, that's it. That's 5-1-1.
So when you hit that 5-1-1 milestone, that is your signal. That's when you pick up the phone and call your doctor or midwife. They'll tell you exactly what you need to do next.
So you've made the call, but your provider might say, hey, why don't you labor at home for a while longer? This is super common. Early labor can be the longest part of the whole thing. So the focus kind of shifts from, is this it, to how do I get through this? The name of the game now is comfort and saving your energy. I absolutely love this quote because it is so true. For a lot of people, early labor can last for many, many hours, sometimes even a day or two. You really want to pace yourself. This is not the time to panic or rush around. It's the time for patience and just taking care of yourself.
Honestly, staying mobile is one of the best things you can possibly do. Gravity and movement are your best friends right now. Going for a walk, swaying your hips, circling on a birth ball, all of that helps the baby move down and can really help with the discomfort. A warm shower can be amazing for relaxing your muscles. And hey, don't underestimate a good distraction, like a movie or some music to help the time pass.
And remember, labor is a massive physical event. You need fuel. So stick with clear liquids and light, easy-to-digest stuff like toast or fruit. You want to avoid anything heavy that might upset your stomach. Oh, and keeping your bladder empty is actually super helpful because it gives the baby more room to move down.
Now, this is really important. While the 5-1-1 rule is a fantastic guide, there are definitely some situations where you just need to throw the rules out the window and call your provider right away. Let's go over these critical red flags.
So pay really close attention to this list. If your water breaks, even if you're not having contractions, you should call. Any bleeding that's bright red and more like a period needs an immediate call. Same goes for any big decrease in your baby's movements, or if you have severe pain that just doesn't stop between contractions, or a fever. Any of these things mean you don't wait.
And this really brings us to maybe the most important piece of advice of all. After all the timing and symptom checking and everything else, never ever ignore your own intuition. You know your body better than anyone. If something just feels off or you have that strong feeling that you need to be checked out, make the call. Always trust yourself. So there you have it. We've decoded the signals, from the practice runs to the real deal signs. We've talked about the rules to follow and the red flags to watch for. You have the knowledge now. The final step in this whole journey is the most personal one, just trusting that you know how to read the signs and listen to what your body's telling you. You've got this.